I'm Dr. Ng Chin from Raffles Hospital in Singapore. I'm a colorectal surgeon, so my specialty deals with... good morning, Cambodia. This is Dr. Ng. My full name is Dr. Ng Chin, and I'm from Raffles Hospital in Singapore. I'm a trained colorectal surgeon, and basically what that means is that my specialty is in problems like hemorrhoids, piles, scopes, and things like colon cancer. That's what I deal with on a daily basis.
I have some question for hemorrhoids.
Hemorrhoids or piles are actually small cushions or small tissues in the anal canal. They usually serve a purpose in keeping continence, so that patients do not actually leak or soil themselves when they walk around on a daily basis. It's only when these problems actually swell up, then people end up with bleeding and pain, which is the reason why they come to see us for hemorrhoids.
How does hemorrhoids form in human body?
Hemorrhoids are a bit unusual. They only occur in human beings and liver. That's the commonest cause of piles in Singapore. Second to that, people who get chronic constipation will always tend to end up with piles also. If the patient also strains a lot in the toilet, as in they spend a very long time sitting in the toilet, either reading newspapers or answering the texts, answering emails, tend to develop piles. In females especially, patients who are pregnant will also end up with a higher chance of getting hemorrhoids. Some people also think or ask whether it's genetic and passed on from family members, even though a father may have it and the son may have it and daughter may have it, but there's no proof to show that it's actually genetic. The cause is more likely to be the same diet that they share in the family, and that results in having piles in patients.
Can you show hemorrhoid variety?
Yes. For hemorrhoids, there are different sizes, from the small first-degree piles to the largest fourth-degree piles. For the early stages of first-degree piles, we can treat with just medicine or tablets alone. Sometimes some people can treat with pills and creams, and that is usually enough to treat the early piles. For the later piles, from second degree onwards, it's a bit more difficult. So we usually have to look at other procedures like small minor surgery or bigger surgery to perform on these patients.
What is the method treatment?
There are many treatments available for piles right now, ranging from simple medicines to minor surgery like rubber banding to proper surgery itself. And proper surgery, there's many different types. We have the famous one, which is the stapler hemorrhoidectomy or Longo's procedure, which is well known across the world, whereby we use a stapler to actually remove the whole ring of piles and then join the tissues together. A very good operation, but there's also newer ones that come along. We particularly have interest in two new procedures. One is ligature hemorrhoidectomy, where we use a special vessel sealing device to remove the piles and seal up the tissues. So basically there's no minimal wounds and there's very minimal pain from it. The good thing about this procedure is that they use the patient's own tissue to seal it together. So there's no stitches, there's no staples, and there's no foreign body inside, which will cause sometimes a reaction like infection in patients. So there's very little chance of infection from them. We have to choose the patients carefully, so certain patients are suitable for each of these operations. The second operation that we do nowadays that's new is called THT, or otherwise known as transanal hemorrhoidal dearterialization. That's the newest procedure that we have in Singapore. And basically what that does is that we actually use a special probe, the ultrasound probe, to go into the anus, and then that locates the blood vessel that supplies the piles. And then we actually tie each and every one of these vessels up. By doing that, that actually reduces the blood supply to the piles, and therefore we can shrink, and therefore treat the patient. So there's no need to actually cut any of the piles out. We just have to cut up the blood supply, and then the piles will shrink, and the patient's happy. The advantage or good thing about this is that it is very painless. Okay? It can be done very quickly, and it's very short healing time, usually in terms of 1 or 2 days, and the patient can usually travel after. So very effective treatment.
Can we protect ourselves from the disease?
Yes, PALS can be. PALS are not only treated with operations. They are treated with a combination of surgeon and patient. So the doctor can offer them an operation to cure the PALS, and then the second part is where the patient comes in. Okay. It's a joint effort between both the doctor and the patient, and the patient can actually help by adjusting a few things in their lifestyle after the operation. In terms of diet, they have to eat more fruits and vegetables. Okay. That will help to reduce constipation, and therefore reduce the chances of having a recurrence. The second thing is also the habit which they spend in the toilet. A lot of people that we know in Singapore will tend to go to the toilet and spend 15 minutes, half an hour sitting in the toilet, either reading newspapers or something else. But that is not good because a lot of patients actually end up subconsciously applying pressure down below and therefore making the PALS worse. So we usually advise patients to have two things. One is to adjust the diet, so more fruits, more vegetables. That's also healthy lifestyle. And the second method is to actually control the time that they spend in the toilet. So they keep it short, about 5 minutes the most. Okay? And then as they are doing it, not to strain all the time. And just by doing this simple two-step lifestyle approach, we can actually reduce the chance of having a recurrence for the patient. So quite easy to treat. I think for the current situation, because a lot of patients think that operations of PALS are very painful, so they do not come to see us until very late. And the later and the bigger the PALS are, the more the pain the patient can suffer, even with the best operations. So usually we advise the patients to come earlier, and we can give them simple tests and simple treatment that will cure the PALS earlier. Okay. And the earlier they are, the easier and the less painful the procedures are. So the first is to make patients aware and understand that PALS treatment can be painless, and they can be as painless as coming in and then you can walk out of the surgery without any pain at all. Okay, that's the first thing to remember. The second thing to remember is to come and see us earlier so that the treatment can be more effective. The later and the bigger the PALS are, the more difficult the treatment will be. So those are the usual two things that we always tell our patients. We tell all the friends that if you want to get treatment for PALS, come early. Okay, and when they are small, there's more that we can do for them, and they are much happier. I think as a last note, we must also differentiate between PALS and other more serious problems like colon cancer, especially for the older patient and for the patient with a family history, somebody who has got a relative with cancer. We have to make sure that the bleeding that they see is due to PALS and not something more serious like a cancer or an early cancer, because the treatment is very different. And we treat the wrong thing, the patient will not be cured. So it is very important that when they see us, we do a proper examination, take a proper history with the patient, and also to check them properly to make sure that is it PALS that we're dealing with, or is it something more serious that we're dealing with. Many times we have to tell the patient, especially if they are older, above 50, that we have to do a scope. That's an examination to look at the intestine inside to make sure that there's no cancer before we do the surgery for. Then that is a comprehensive way of treating problems of PALS.
Thank you.